What are the complications of laparoscopic hysterectomy? Laparoscopic hysterectomy is a surgical procedure where the uterus is removed through laparoscopic method, and this is one of the major surgeries. Here the patient is benefited in terms of fast recovery, shorter hospital stay, less amount of bleeding, and also the comfort that the laparoscope will offer because it is a minimally invasive procedure. But then again, like any other surgical procedure, laparoscopic hysterectomy will have its own complications and side effects. So the most common complications that we come across after or during hysterectomy is one, bleeding. So there could be inadvertent bleeding from the blood vessels in the pelvis, especially the uterines, which can lead to blood loss, and this depends on the competency of the surgeon to handle it and do the procedure, and also this depends on the condition for which the hysterectomy is done, the size of the uterus, the anatomy of the pelvis in that patient, and the associated comorbidities. The second complication could be the injury to the adjacent structures. So since pelvis is has different anatomy in different women, most of the times because of the conditions like endometriosis and adenomyosis, where the anatomy can be distorted, there could be injury to the adjacent structures like ureter, bladder, intestines, and major blood vessel, which can lead to complications. And this, if identified during the surgery, it can be sorted out completely. If it is identified after the surgery, then it will require extreme care for the patient to recover from the complication. Infection is again one of the complications which can happen, just like in any other surgery. If the asepsis condition is not maintained, or if the patient is prone for infection where the immunity of the patient is very low, like if she has anemia or if she is immunocompromised, then infection could be one of the major complications which has to be tackled. The infection can happen immediately post-operatively, or it can happen like after 10 days of the surgery also. The bleeding from the vault, that is from where we have stitched the vagina after removal of the uterus. So from there the bleeding episode can happen, which can be again due to the blood vessel opening where it is not coagulated properly, or it can happen in cases where there is infection. So this has to be again tackled depending on the reason for the bleeding from the vault, and it has to be managed correctly. So again, after hysterectomy, there could be episodes of like say fever, tiredness, exhaustion. All these, we don't call it as complications, but these are associated factors and side effects which we will have to manage post-operatively. So adhesion formation, that is the organs getting adherent to each other, like the intestines getting adherent to each other, can happen post-hysterectomy, and this depends on the patient's tendency to form adhesion, the condition for which we have done the hysterectomy, and this can be managed intraoperatively by using the right kind of suture material, also by using the correct technique of tissue dissection, and it helps in better healing of the organs, and also better care should be given to these patients, especially in post-operative period if they come back with pain abdomen or if they come back with abdominal distension. So these are few of the complications that I have mentioned. So I think all these should be discussed with your healthcare professional before you go ahead with your decision on hysterectomy. Adverse reaction to anesthesia and anesthetic drugs is again it is like for any other surgery which can happen in hysterectomy also. Conversion of a laparoscopic hysterectomy to an open surgery could happen if at all, if the surgeon is unable to finish the procedure through laparoscopic route. Pain and discomfort could be there because if it is a prolonged surgery or because of the healing. So sometimes this can happen.